SAGE here in the UK. It's been providing alternative scientific advice. So she's very well placed to give us an overview. Thank you. Welcome again to BBC News, Zubaida. I want to look at India first because it does seem that there's something of a perfect storm of conditions that's created what looks like a rather uncontrollable situation.
It is incredibly devastating, isn't it, when you look at India at the moment, when you look at the thousands and thousands of deaths per day. We're being told officially it's around 3,500, but we know that's a huge underestimate. We've seen appalling and devastating and just harrowing pictures of people outside of hospitals begging to go inside because there is not enough beds, there's not enough medical oxygen, there are no masks anywhere, people are absolutely desperate, and of course fewer than 10% of the population has been vaccinated, and we know that there's been a real slowdown in vaccinations. So it is an absolutely desperate situation at the moment in India.
In theory, vaccination opens up to anyone in India, any adult in India, from tomorrow. What do you think about likely take-up? Will people be ready to go?
It's difficult to say, isn't it? I mean, given some of the problems in India at the moment has been a real slowdown of vaccination. Of course, back in January and February, India was boasting about having the sort of fastest vaccine rollout in the world, where they had something like 100 million jabs in about 85 days. But it's been rapidly slowed down. Prime Minister Modi has been criticised for exporting far too much of the COVID vaccines instead of keeping it for home. It's difficult to say. I mean, the biggest issue you have at the moment is if you open up the vaccine for everyone without having a priority list, then that begs the question of who will come first. And I know at the moment, you know, one of the things we've learned, for instance, across the world with this pandemic is that COVID-19 is a pandemic of inequality and poverty. And that's nowhere, you know, more apparent than in places like India and places like Brazil, and so on. And I think there are real concerns that if you have a vaccine rollout that's for anyone and everyone, is concerned about who will be prioritised and whether, once again, the poor and those on lower socioeconomic groups will be pushed to the back.
And you've referred to the fact that India has exported vaccines. It's been a key supplier for many of us around the world. And that's one way, I suppose, in which what happens in India, for example, is actually a global story.
Absolutely. I mean, at the moment, we have to understand that nowhere is safe until everywhere is safe. And that's simply because the virus travels when people travel. Our borders are not strong enough to keep the virus out. And we've seen that play out in the UK, where we now have more than 400 cases of the Indian variant. We also have well over 130 cases of the South African variant. The variant is everywhere at the moment. South African, the Brazil, the Indian variant, and that's partly because our restrictions have been incredibly poor. Our quarantine is porous, and our red list just simply doesn't work. Red list of travel, of banning certain countries and not banning others, doesn't work. So we need stronger borders, but we need to understand that unless we help countries like India, like Brazil, you know, the countries where they're having really huge surges in COVID virus and their systems are not coping, unless we can't help them, the virus will simply come back to visit us on our doorsteps.
And yet, I want to put a question to you, Dr. Haque, about human nature, which is that since we've all gone through fear and lockdown, isn't it human nature to want to get out there when lockdowns are lifted, to socialise, to see loved ones? Public health bodies have to keep the psychology of us all into account.
It's really, really important, isn't it? I mean, let's face it, the last lockdown for most of the world, especially Western countries, has been particularly brutal because it's been over the winter months, dark days, long lockdowns where you're simply stuck at home. And we know that that's had a real mental health toll where people have not been able to see each other, including over Christmas. It's not the lockdowns that are the problem. The real problem is that the countries that are going into lockdown are going in because they're not using test, trace and supported isolation in the way that they should. They don't have strong border restrictions and quarantines. They don't have the COVID public health measures that you need to keep the virus down and to make sure that it stays down. And that's why they've been going into long lockdowns. But on top of that, Philippa, the biggest problem is a lot of the Western countries are coming out of lockdown too quickly, too soon, and too much. And that's partly, and we're seeing that. We've seen that in Europe, where they lowered the cases to quite a low rate. In India, in February, there were almost about 11,000 cases per day. Now we have over 380,000 cases per day. And the reason that happened is because India relaxed too soon. They said that the pandemic was over. The Indian government basically declared the pandemic over. They declared that they'd reached herd immunity when they hadn't. And that meant that people were mixing once again. And once again, as soon as you mix, that means transmission of the virus happens very easily. But more importantly, Philippa, that's when variants occur. The more mixing that happens, the more opportunity there is, the more likely viruses mutate. And so that's a huge problem. And that, of course, is a lesson for everywhere in the world, which is lockdowns are brutal. Nobody wants lockdowns. So when you come out of lockdown, learn that lesson and come out of it slowly and come out of it cautiously and watch the data. Don't do it by dates, do it by data.
Dr Zubaida Haque, a lot there to think about. Thank you very much. And of course, we have much more.